Screening for pancreatic cancer is a medical approach aimed at detecting the disease at an early stage before symptoms appear. This is especially critical because pancreatic cancer often presents late when it has already progressed and is less treatable. Here's an in-depth look at pancreatic cancer screening. 1. Overview of pancreatic cancer. Pancreatic cancer is the fourth leading cause of cancer-related deaths globally. It is aggressive with a poor prognosis due to late detection. Early-stage pancreatic cancer often lacks symptoms, making early detection challenging. 2. Importance of screening. Early detection can significantly improve outcomes, as curative surgical resection is only possible in early stages. Screening is generally focused on high-risk individuals rather than the general population due to the low overall incidence of pancreatic cancer. 3. High-risk groups for screening. Screening is recommended primarily for individuals at higher risk, which includes genetic predisposition, family history of pancreatic cancer, 2 or more first-degree relatives, known genetic syndromes, e.g. BRCA1 tau, Lynch syndrome, PLB2 mutations, Peutz-Jeghers syndrome, chronic conditions, chronic pancreatitis, long-standing diabetes, especially new-onset diabetes after the age of 50, lifestyle factors, heavy smoking or alcohol consumption, obesity. 4. Screening methods. Several techniques are used for pancreatic cancer screening. A. Imaging techniques. 1. Endoscopic ultrasound, EUS, highly sensitive for detecting small pancreatic lesions, minimally invasive and can provide detailed imaging of the pancreas. 2. Magnetic resonance imaging, MRI, magnetic resonance cholangiopancreatography, MRCP, non-invasive and useful for detecting abnormalities in the pancreatic ducts and tissues. 3. Computed tomography, CT, scan, high-resolution imaging for detecting masses or abnormalities, but is less sensitive for very small tumors. B. Biomarkers, CA19-9, carbohydrate antigen 19-9, a commonly used blood test, but lacks specificity and sensitivity for early-stage disease. Elevated in advanced pancreatic cancer, but also in other conditions, e.g. gallstones, pancreatitis. Emerging biomarkers. Efforts are ongoing to identify reliable biomarkers like circulating tumor DNA, exosomes, and metabolites. 5. Screening protocols. Timing and frequency. Screening protocols vary depending on the risk level. High-risk individuals begin screening around the age of 50 or 10 years earlier than the youngest affected relative. For those with genetic syndromes, screening may begin earlier depending on the specific mutation. Multidisciplinary approach. High-risk individuals are often managed in specialized centers with expertise in pancreatic diseases. 6. Challenges in screening. Low prevalence. General population screening is not cost-effective due to the low incidence rate. False positives, negatives. Current tools can miss small lesions or result in unnecessary interventions for benign findings. Risks of procedures. Techniques like EUS and biopsy carry risks of complications. Psychological impact. Screening can cause anxiety in high-risk individuals. 7. Emerging developments. Liquid biopsies, blood-based tests to detect circulating tumor DNA or proteins specific to pancreatic cancer are under investigation. AI and machine learning, advanced algorithms to analyze imaging and genetic data for earlier and more accurate detection. Clinical trials, ongoing studies to validate the efficacy of new biomarkers and screening methods. 8. Recommendations for screening. Screening should be done in the context of a personalized risk assessment. Individuals with a high risk should consult with a genetic counselor or a specialist in pancreatic diseases. Participation in registries or clinical trials is encouraged for high-risk individuals. 9. Limitations and future directions. The absence of universally accepted guidelines for pancreatic cancer screening highlights the need for more research. Improved understanding of risk factors and advancements in diagnostic technologies hold promise for enhancing screening effectiveness. Early detection of pancreatic cancer remains a significant challenge, but targeted screening for high-risk individuals has the potential to save lives. Ongoing research and innovations are key to improving outcomes.